Okay, so Dave King DDS here again. We're going to go ahead and talk about periodontal disease and my discussion that I like to have with my patients regarding periodontal disease. So I mentioned before, after I do that initial quick exam, I'm going to go ahead and sit the patient up after I've probed. We've done the oral cancer screening and the palpation. We've done the periodontal probing, but we haven't done the tooth exam. So in between the periodontal probing and the tooth exam, I'm going to sit the patient up, talk about their gum disease. And here's what I like to say. Here's how I like to discuss it with the patient in a little more depth. So I usually ask them, do you know much about gum disease or periodontitis? And then I'll wait for them to respond. A lot of patients are like, no, I really don't know much. Some people ask me, I've never had my gums measured like that. Tell me about it. But generally speaking, a lot of people don't know much about gum disease. And I like to discuss it in the simplest terms. Periodontal disease or periodontitis or gum disease is an active bacterial infection. The challenge with this infection is it's not in a place where the body's immune system can effectively deal with it. It's in between the tooth and the gums in a space where the immune system can't get to it. So what we see is one of two things. Number one, if left untreated, it is the leading cause of tooth loss according to the American Dental Association. And then number two, it also elevates your risk of heart attack and stroke because of all the inflammation and the infection that's happening in the body. Is that something that concerns you? And you always want to gauge the patient's concern level. And you don't want to be manipulative at all, and I can't stress this enough. We want to figure out if what we're diagnosing actually concerns the patient. Now, should it? Based on my experience, knowledge, and training, absolutely it should be concerning to the patient. But a lot of people aren't concerned. And a lot of people are like, yeah, it doesn't hurt. I'm not worried about this gum disease. I'll worry about it another time. But I think it's really crucial, really critical that we as providers give them enough information to make that decision rather than just saying, you worried about the periodontitis you have? We want to make sure that we let them know this is a health risk to you. We know now, based on studies released this year in 2017, that periodontitis elevates your risk of heart attack and stroke. For some of us, it can increase our risk of stroke by as much as 5 times. And there are some studies that show that in the US, adults over the age of 30, 74% of us have some form of advanced gum disease. Certainly in New Mexico, where I was from, it's number 1 in the country for the incidence of periodontitis. But we also know that some of the governmental studies that have been done ranking the incidence of gum disease could be off by as far as 50%. So we know that periodontitis, that number that came from the NHANES study in 2010 was 47%. Well, we know that that could be off by as much as 50%. So what's half of 50%? It's 25%, so we could be seeing as much as 75% because the way that NHANES study probed, they didn't check the interproximal areas. So there's some issues there, potentially with regard to diagnostic rates. So we know that periodontitis has an extremely high incident rate across the country. So we want to make sure our patients are aware of what the risks are. And one of the other things I like to tell my patients is, this is a conversation that I have all day long. We know 3 out of 4 patients have some form of gum disease. So this is a common conversation. I want that patient to feel like they're in a group of people. They're not that one individual person, out eliminated from the crowd who's got this special, unique circumstance. I want them to feel like, yeah, there's a lot of people that have this, and we treat this all the time, because that's true. But I also want them to feel like they're in a group of people so they can identify with them. So as I'm discussing the periodontal disease with them, I want to give them plenty of opportunities to discuss this. Most of the time periodontitis in the early to moderate stages, even the advanced stages, there's no pain for most of these people. They're not aware of anything until they start to see the gums change or the teeth start to move around. So they may not actually have issues with their teeth at this point that they're aware of, absent me telling them. So I want to gauge their concern level. Does this concern you? Do you understand? I want to check in with you. I'm curious how you're feeling about this conversation. Tell me what questions you have at this point. But what's more critical is that you give the patient time to answer. I've done a lot of coaching, and I've been coached a lot by great coaches, and one of the things that stands out to me from the coaching I've received from a lot of the different coaches out there is you want to make sure the patient has time to respond. Give them a few seconds to think and process the information. Otherwise, there's no real opportunity for them to acknowledge what's going on. I feel like a lot of times as a dentist, I'm trained to just go in there and rapid fire off, here's what you have, here's what you need, and then leave. When in reality, we should be doing more educating. Here's what's going on in your mouth. Here are some possible consequences of inaction. Here's a timeline of when this may happen. Does that concern you? That was 5 seconds. That was a 5-second wait. So giving the patient a few seconds to respond, there's no harm there. And it will really give the patient some time to process. I've found in my life all the important decisions that I've made have happened in that few seconds of silence in between, discussion times or when my mind is calmed and quieted. So we want to give these patients an opportunity to really process it. And I give them time to change their mind too. If you have a discussion with them and at the outset they're like, I'm really not interested in discussing this, it's not something I want to worry about, go through the rest of the exam. That's totally fine. Go through that exam, discuss with them their tooth concerns, which we'll get to in the next video, chat with them about consequences of the teeth, and then give them an opportunity. Now, I know we talked about the gum disease and you said you weren't really concerned about it. Do you have any questions? What other questions can I answer? And then give them a few seconds again to respond. But what's really crucial is that we're making sure that we're empowering the patient. We want to give the information to the patient and let them choose what's best for them. A lot of docs, myself included in the early years, would refuse to do a basic cleaning for a patient who needs periodontal scaling and root planing treatment. And there are arguments on both sides of the fence. Now, are we going to be supervising their periodontal neglect? Is there a liability issue for me as a provider if I opt for allowing treatment to happen when they need another treatment? Well, those are good questions, and those are questions that I don't necessarily have all the answers to, but let me explain what I like to do and what's worked well for me in the past. I'm okay with doing a basic cleaning for a patient, a prophylaxis, a scale and polish for a patient who needs scaling and root planing, as long as they understand that I have informed them of the challenges of doing nothing, of the issues with doing nothing. I want to make sure that they know, if left untreated, this periodontal disease will lead to a higher risk of tooth loss and a higher risk of heart attack and stroke. As long as they're aware of that and they've acknowledged that they're not concerned, then I'm okay with doing a basic cleaning. I feel like some treatment is better than no treatment, and although the basic cleaning, and this is part of the conversation I have with the patient, the basic cleaning isn't going to treat your gum disease. This is a polish and floss. This is like taking your car to the car wash when it needs a detailing and only doing the outside. Sure, we'll polish and scrape what's above the gums, make your teeth nice and pretty again if you've got some stain, but this is not going to treat the problem that's down in the gums. This is not going to treat all the garbage that's on the floorboard in your car, if you will. So as long as they are aware of the fact that they are choosing to not seek treatment for that gum disease, I'm okay with doing a prophy. I'm totally fine with that. And I remember Steve Thorne asking this question at an owner doctor meeting. How many of you want patients to start treatment the first time? Well, all of us raise our hands. How many of you want patients to start treatment the second appointment? Well, of course, all of us raise our hands. Then he went third, fourth, fifth, and sixth. And by the time he asked the sixth, most people didn't raise their hand. And he asked this, he's like, why aren't you all raising your hands? You want all of these patients to stay in your practice. I'm not going to fire patients because they didn't want to start the treatment I recommended until the sixth appointment. I want to develop a trust with these patients. And for some of these people, it may take a while. It may take a while for us to really establish that rapport for the patient going forward. And as long as we've documented that they've been informed and we've authentically, genuinely informed them of what's going on in their mouth, then in my experience, I think that fulfills our burden from the standpoint of ethically informing them of what's going on in their mouth. Now, there's certain documentation that you may ask them to sign, an acknowledgement of periodontal disease and the fact that they're only seeking a basic cleaning, and that's totally fine. But as long as we've told them what's going on, explained the consequences, I'm happy to help them any way I can. Ultimately, we have patients that have needed scaling and root planing for years, and they come in for their basic cleaning, and I talk to them again about their gum treatment again and again and again and again. And I'll continue to do that. I won't fire a patient from my practice for that reason. If they're coming in and seeking some treatment, I'm going to do my very best to help try to win them over to the treatment that they actually need going forward. Now, there may come a time when you have patients that need treatment that are refusing any treatment whatsoever, and that's a different story. But if we're able to do something for them, whether it's a basic cleaning, or maybe add some irrigation, or maybe a laser, or maybe just a little bit extra scaling in certain areas as we can, I see that as a solid service to our patients. And in the end, that's why we're here, right? To serve people. So, from the standpoint of periodontal disease, I want to make sure that the patients know what they have. And I'll pull the chart up in front of them, show them the numbers, 1, 2, 3, 4. See these red numbers here, 4 and above. That tells us you have active infection in these areas. That concerns me. Talk them through what's going on. If you have a comparison chart, make sure that they are aware of how things have gone, up or down. And then acknowledge that they are the one choosing treatment. But show them what's going on. Talk about the consequences of inaction, recommend actions, and then let the patient make the choice. In the end, that's what we're here to do, is to educate, inform, and offer service. I think a lot of us get hung up on the fact that we're not doing a lot of service sometimes, when in reality the most crucial part is offering that service in the right environment with the right preparation and the patient understanding. That'll give us the opportunity to serve more and more and more as we develop our confidence, our skill level, and really establish a trust relationship with that patient going forward. After all, patients are people too, right? Okay, so that's all for this video. We'll talk in the next video about case conversation discussion with regard to restorative care and some of the more complicated implant and denture bridge cases. So thanks for watching. See you in the next video.